This is the two-phase method that will revolutionize your performance in the OET speaking section. The first thing you want to do in phase one is introduce yourself. Who are you and what is your role in this consultation? Then you want to ask for the patient's first and last names and also clarify the title that they would prefer you use. For example, Mr., Mrs., Ms., or can you call them by their first name? That's something you want to find out at the very beginning, and also ask for their date of birth. Next, in phase one, you need to find out why the patient is presenting. You can ask, what has brought you here today? Please tell me, how can I help you today? Now the patient is going to explain to you what is on their role-playing card. Most likely they're going to complain of unpleasant symptoms, worrying signs of possibly fatal diseases. So you need to show that not only are you listening, but you're also feeling their pain and their plight. Okay, so you can use phrases like, oh, that must be very difficult for you. Okay, phrases that signal empathy. Next, you want to ask them what it is specifically that they are concerned about. Is there anything that they really want you to answer during this consultation? And then empathize again and summarize what you understood that they have told you during phase one. You can say, okay, let's make sure we're on the same page here, and please correct me if I'm wrong. But it sounds to me as though you're saying that you are here today because maybe you've been experiencing very dry, itchy skin, and you're worried about whether or not it could be because of an allergy to your new dog, and you're very worried about that. Am I correct? Okay, and now this will give the patient the opportunity to correct you if you've misunderstood. It will also give them the opportunity to add any extra information that has occurred to them or that they've noticed they haven't given you yet on their role-playing card. So phase one was all about finding out why the patient is here, who they are, and what they want from you. In phase two, it's now your turn to talk a bit more. Okay, these would be about 3 minutes. This was the opening 2 minutes. Here, these are the final 3 minutes, and it's your turn to talk a bit more and to start dispensing the information and to explain to them a bit about their symptoms and a bit about their condition and any treatment or diagnostic tests that they're going to need to have. However, before beginning any long explanations, make sure that you find out what it is they know already about this condition or about this procedure so that you're targeting it at the right level. Don't assume they know nothing. Equally, don't assume they already know a lot. Find out first. Also, you need to avoid technical language. Do not use Latinate medical textbook words. Use everyday accessible language and make sure you're using a variety of grammatical structures and idioms. Do not talk and talk and talk and talk as though it were a lecture in a university. It is a conversation, so you need to periodically stop and check to make sure that the patient is understanding and find out if there's anything that they would like you to explain more thoroughly. Also, your explanations must clearly relate to the information that you were given in phase 1. This cannot be a standardized explanation that you could give to anybody. You need to make clear in your explanation that you are taking into account the concerns that they expressed to you in phase 1, and that you are addressing your explanation to them and to their individual situation. Before finishing the role play, make sure, if there's time, to ask them if there's anything else that you can do for them. You see, this role-playing card is for the patient, for the actor. It explains that the actor is to say that they are suffering from epigastric pain in the stomach and abdominal area, and that your doctor ordered a barium meal test for you. So the patient has presented hoping to get the results of this test. It tells the patient what their worry is. They're worried about cancer. It also gives them the backstory, and it's quite a unique backstory. This patient had epigastric pain 5 years ago, and they were prescribed anti-ulcer tablets for a period. However, they didn't complete the course of tablets, and so now they're worried, thinking, are they to blame? Has their failure to complete the prescribed course resulted in this pain? So they've got a very specific concern that they're going to explain in phase 1 of the speaking exam. In phase 2, the physician is likely to say that the patient needs a gastroscopy in order to further examine their case after the results from the barium meal test. The patient, however, has been told to say that they do not like the sound of it at all. They think this sounds horrible. And also you can see how difficult the OET makes life for students. It says here to the actor, be difficult to reassure. Okay, so the actor here is under instruction to be difficult with you. Now let's look at the role-playing card that the doctors were given in this role play. So it explains much of the same information. It says that the barium meal test, which you ordered, shows an ulcer on the lesser curve of the stomach, which may be malignant. Okay, so there's possibly bad news that is having to be delivered here today. This is a new patient for the doctor, and so they have no details of previous epigastric pain, meaning they have to ask questions in phase 1 in order to get this information from them. It says you need to explain the possibility of malignancy to the patient. You need to question the patient about their previous episodes, about their record, and then you need to advise them that they need a gastroscopy, and you need to explain it in layman's terms as simply and as reassuringly as possible, because as we know from the other role-playing card, the patient is going to tell the doctor, I do not like the sound of that at all, that sounds horrible. Also, it instructs the candidate to find out what else the patient wants to know, of course. That will be in phase 1 and in phase 2. Try to reassure the patient by mentioning other possible non-malignant causes, for example, just an ulcer or indigestion, not necessarily cancer. But you have to be honest and clear, it could be cancer. This is Dr. Otero. He is a clinical oncologist from Colombia. And as you can see, he performed very well indeed in this mock speaking exam, getting a high A grade at 95% of the points. Let's watch the first half of his role play and see how he meets all of these phase 1 points along the way. When you're ready then, please.
Hi, good evening. My name is Jorge Otero. I'm your physician for this appointment. Nice to meet you. What is your name?
It's Lily Brereton.
Very nice to meet you, Mrs. Lily. What is your date of birth?
The 9th.
So one small problem here, he introduced himself and he got her name and he's getting her date of birth now. However, he wasn't clear about her title. He called her Mrs. Lily. So Mrs. assumes that she's married, which might not be the case. And also it would be Mrs. Brereton, her last name, not Mrs. Lily, her first name. So that's a mistake there.
18th of the 9th, 93.
Okay. Well, we have the results from your barium meal that you're bringing today.
Mm-hmm.
And before explaining to you the results, I would like to know what were the reasons for my colleague to order this test before.
So I've had a pain in my tummy for a couple of months, and it's just sort of getting worse, really. So that was the idea, that they did the test just to see why.
Okay, how long have you been feeling this abdominal pain?
A week this time round, but I've had it before a few years ago, and I was prescribed something then. I can't remember what that was, but I don't know if I finished the course of the medication, and I'm worried that it didn't work and now it's back again, and if it's something worse this time, and I just would like to know what's
you were feeling okay during a certain period of time?
Yes, so in between the two.
Okay. Have you had any other symptoms besides the pain?
No, that's it. It's just the sort of pain in the stomach.
Okay. Do you have any important history in your family about?
Not that I know of, but I'm not close to all of my family, so.
Okay, Ms. Lily.
So we see that he has effectively gathered a lot of information in phase 1 of the role play, which lasted around 2 minutes. Let's now look at phase 2 of Dr. Otero's epigastric pain role play. Okay,
Ms. Lily, because the results of the barium meal are not so okay as we would like them to be. There's an ulcer in the one part of the stomach, and although there are possible reasons for this ulcer, we have to rule out there is a malignant ulcer. So I will have to order you another test that is a gastroscopy. Have you ever heard about this test?
No.
Okay. They will introduce a tube through your mouth. They will get in through the esophagus, and they will reach your stomach, and they will see it from the inside. It's not that uncomfortable, and you can be do it. It can be done under anesthesia, so maybe you will not feel that uncomfortable doing that procedure. And then we will see what you have. What is this ulcer about? So remember, although it could be malignant, there are also benignant ulcers. You don't have family history, and you have been rather okay during a long time. Mm-hmm. So I think it will be all right, but we have to do it.
Okay, because it could be cancer?
Yeah, it could be cancer. So that's why we have to do it.
Right.
And the sooner the better.
Yeah, of course. Okay. But I can be fully asleep for the gastro.
Yes.
Yeah. Right.
Mm-hmm.
Okay. Because that doesn't sound very nice at all. Is there any other thing we can do instead of that? Because that sounds unpleasant.
It is not that very pleasant, but I don't think there's no other test that we can do to rule out this thing that we have found in the barium meal. So I think it's the best course of the best option that we can take right now. Okay.
And do you think it's happened because I didn't take the medication properly the first time? Like, is it my own fault?
I don't think it was because of that. But let's wait until we have the results and we see what happened. Maybe it's another ulcer. It's an ulcer from gastritis, and that's it. Okay. And
right,
then,
excellent. Thank you very much for that.
Okay.
As we can see, then he did a very good job, especially with the linguistic criteria. His pronunciation was very good, spoke very fluently. He used appropriate language throughout, and he avoided any overly technical terms. He also made sure it was a conversation. He gave the patient the opportunity to contribute with her concerns and with any questions that she had. He didn't get a chance to ask her at the end if there was anything else that he could do for her, but he just didn't have enough time. I hope you found this exposition of the two-phase method for OET speaking success useful. I want to let you know that I offer personalised support in the form of group and private classes for all 4 of the OET subsections: speaking, reading, writing and listening, and for all healthcare professionals. So if you're interested, you can register below in the Google form, or just leave me a comment or send me an email. Thank you very much for watching, and I'll see you in the next one.